Esteemed panelists, participants, and hosts, everyone, good morning, good afternoon. It is a pleasure joining this important meeting convened by USAID's Health Evaluation and Applied Research Development, HERD project, led by University Research Corporation and co-hosted by HERD's partners, East Central and Southern African Health Community and the University of California, San Francisco. Earlier this month, on May 3rd, 2021, in her remarks at her USAID welcome ceremony, USAID's new administrator, Samantha Power, talked of the importance of promoting dignity. Quote, dignity, perhaps best summed up in a simple borrowed phrase. Nobody is better than you, but you're better than nobody. Something we hear President Biden talking a lot about. The idea that every individual has equal worth. Every individual deserves to be treated with respect, end quote. USAID is proud and humbled by the achievements to date of country-led efforts to define the challenge, develop the policies, support the process of understanding how to provide maternal and newborn services that are respectful and dignified, and most importantly, to develop effective and sustainable solutions to complex maternal and child health issues. While we know that disrespect and abuse is disproportionately meted out to marginalized women, in personal conversations with local government authorities and Tanzanian elite, including women medical doctors, I have learned of their encounters with disrespect, which has even resulted in the loss of their newborn babe. So I am aware that this is a very personal issue for many. Only a decade ago, we barely had the language and data with which to describe the challenge of disrespect. Information was confined to anecdotes and individual experiences, and the prevalence of maternal mistreatment was unknown. We are conscious and appreciative that the leadership in advancing this work globally relied upon landmark studies conducted by East Africans, in particular in Kenya and Tanzania. After supporting studies to quantify and describe the problem and to explore solutions, we have started to consider how best to learn and share lessons about effective evidence-based packages of interventions that can be applied in the health system and community to address the inequities and injustices, which we have learned are disproportionately thrust on women who are young, less educated, and disempowered by their communities. We are also exploring ways to support country leaders, civil society, medical professionals, and champions to measure the results of these activities and identify ways of promoting their implementation at scale. USAID has seen a global awakening to the importance of respectful maternity care, even as this reorientation of the health service delivery system was severely tested over the past year with the chaos that the COVID-19 pandemic wreaked on essential services for women, newborn, and children. Building on our historical systems approach to promote an enabling environment for service provision, in our deliberations, USAID seeks more sustainable ways to advance the concept of respectful care so that both provider and client rights and needs are met, and neither is pitted against the other in a setting of limited resources and insufficient accountability. We look towards the learning that our partners are now leading to provide us with insights into meaningful ways in which respectful and accountable maternal, newborn, and child health services, voluntary family planning, and reproductive health care can be offered. We must endeavor that the voices of women and children inform the way in which these services are designed, that providers are not abandoned to conditions that are life-threatening and degrading, and that managers convene and lead gatherings in which solutions to the challenges of clients and providers are co-designed. These are some of the aspirations of USAID-supported MCHN programs. I'm sure that your contributions today will help shape the future of service delivery and contribute to safeguarding the dignity of women, children, and families serviced by the health system. I look forward to the deliberations. Thank you.